Welcome back to Stuff You Should Know. Today I am joined by Dr. Aja Nichols of Lifestyle Dentistry. We often think dental care is just about your teeth, but what if your mouth holds clues to your sleep, heart health, energy levels, and overall wellness? In this episode, we're talking about why everything starts with the mouth and why prevention may be one of the best investments you can make in your health. Let's dive into another episode of Stuff You Should Know. Why did you get into this? What is your origin story with dental care? I want to just
Oh,
give the audience
yeah.
an idea here.
That's so funny. So I always knew, like from young age, that I wanted to be a doctor. And so literally I didn't start even thinking about dentistry until I was about 19, 20 years old because I had braces. And my orthodontist would say, you need to become a dentist. And she would joke and say, go into geriatric dentistry because by the time I finished, she'd be old and all that good stuff. Um, and so I never really even took it seriously, and she just kept talking to me. And so I decided, like, after graduation, I was already scheduled to take the medical admissions test and all of that good stuff. And before I even got the results back, I had already spoken with her, gone to observe her at her office to make sure that looking inside patients or people's mouths for the rest of the life rest of my life was something I'd want to do.
Yeah.
um and she introduced me to one of the dean of admissions at Indiana University, and they would have these weekend things where people who were interested in dentistry could come and chat with them and like wax up teeth and things like that. And so I became very interested in that. And studied for the test for like 3 months, the dental admissions test. Um, Studied, and they give you I don't know if they still do it to this day, but at that time, they give you the results like right after you take the test. 10 minutes after you take the test. And so I kind of knew the numbers that I was looking for, got my scores, and I was like, oh my gosh, like I think I'm going to get into dental school. And I called one of the people in the program, that weekend program that I was doing, and he was just like, oh my gosh, let's get your application in. And so I applied to one dental school and got in.
Isn't it funny how things just sort of, when you're on the right path, it just sort of
Mm,
unfolds as you go along. That's all.
yes, exactly.
So your background, so you were initially going in to be an MD, like you wanted to do, what type of medicine were you
Correct.
looking to do?
It's so funny because since I was a kid, it was always neurologist, neurologist, neurologist.
Okay.
And so I always joke about this because in some ways I'm still a neurologist, like a surgeon, because I work in tiny little spaces like I would have been,
Right.
with the brain and everything. And so yeah, it was always neurologist. Like I have a friend who teases me to this day when she came into my room at my college dorm. She just to this day, 20 plus years later, she teases me because she walked in and she's like, I mean, who has a brain in their dorm room? Like, because I could take it apart, put it back together, just nerd stuff, nerd stuff.
Okay. I'm getting a little bit of insight on you here.
Yeah. So just nerd stuff. And so I would always say neurologist. And again, I don't know why. I don't know why that told me, anything. But yeah, that's what it was.
So, which is interesting because it's like your, to me, it sounds like your dream was really close. Neurology is not that far away from your teeth,
From
and
that.
you are dealing with a lot of nerve. And
Yes.
one of the things that you've mentioned recently in your presentations at BNI is how all of our stuff up here is connected to all the other things. So you're
Absolutely.
still, I mean, that's, and so what, we might just dive right into this question because I know this is, I really, really want to get into this, how dental work and why dental care is so important to our overall health. Um, because I mean, I didn't realize that. I mean, I know it's nice to have our teeth and, when we don't floss
Yeah.
and do all the stuff, then we have to do dental work. But it's way more than that.
It's way more than that. I always tell patients, actually anyone I'm talking to, that everything starts with the mouth. Our mouth has to endure every crazy thing that we put into our body, like what we eat, what we drink, smoke, chew, swallow, lick, like it.
Kiss.
Unless I've said this in VNI before, unless someone is doing drugs, snorting, or
Mm-hmm.
pumping them into their veins, like this pipe hole, the only mouth that we ever get, the only set of teeth that we ever get, this is the only way things are going into our body, and we only get one of them. And so, um, I mean, it's just so connect. Tell people all the time, like, um, how can you think that what you put into your mouth does not get into your bloodstream and into different organs? Like that same bloodstream goes to every freaking organ in the body, right?
Mm-hmm.
And so that's just been literally my message to people, is that everything we do, everything since childhood, goes through the mouth.
Yeah,
Everything.
our poor mouths. Um,
Exactly.
so I had knee replacement in 2023, and one of
Okay.
the things they have me do for the last 2 years was anytime I went to have a cleaning, I had to take antibiotics.
Mhm.
Why is that? What is,
Yeah, so literally, so again, when you're in the dental chair, there are things that we produce. So there's bacteria in the mouth, right? So
Mhm.
however we have to clean you, whatever, if it produces blood, that bacteria is in the bloodstream. And again, because the blood filters through the whole body, right? There's bacteria that can, if you have any type of prosthetic on the inside, right? And so our natural organs, blood flows through, around, all of that good stuff. If we have a prosthetic something in there, right? It's
Mhm.
another material that the body may not recognize. Okay. And so that bacteria can go and start to set up on that prosthetic. And so we need those antibiotics to kill whatever bacteria starts setting up, so that it doesn't cause infection and all of that good stuff. And so that
Wow.
there is, yep, there's that it's that the American Heart Association, they kind of go back and forth to say, hey, you need an antibiotic if it's done 6 months, prior to you getting your dental work. And then they take it away and say, no, you don't need antibiotic at all. Then they say, oh, if
Mhm.
it's a prosthetic, oh, but if you have, endocarditis before. So, you kind of keep checking that, because I've had patients who, even though it says no, you're good, you don't have to take the antibiotic, they still feel comfortable taking the antibiotic before any dental procedures.
I have a couple of friends whose father passed away from, he had a knee issue, and there was bacteria, he got an infection, and I mean it was one of these that it
Hmm.
just they couldn't knock it, and
Hmm.
he passed away,
Hmm.
and it was, I mean, it, it's, we just don't think about these kinds of things when we think about
Yeah,
joint replacement. Or I mean, we worry about being
for
able to
sure.
bend and do all
And
of our stuff.
a lot of people think that, oh, the infection came from the surgery. Not necessarily,
Right.
because if his mouth had a lot of bacteria as well, that bacteria is
Yeah.
in the system. It's going everywhere, setting up in places that the body just doesn't recognize as natural.
Right. Well, moving on to a different topic, so because I feel bad. Anyway,
Uh-huh. Uh-huh.
let's talk a
No,
little
no.
bit about your practice and how you work with your clients. Like you've got a different model for your practice right now, and
Mhm. Mhm. Mhm.
tell us a little bit about that.
So if are we talking about actual dentistry, or like the model that I have set up, like membership,
We'll start with the
or both?
membership and how that works,
Okay.
how that goes with how you work with your clients or your patients.
Okay, perfect. So if would you agree that everyone thinks that they absolutely need dental insurance to have dental work done?
It is one of the biggest myths out there. You do not
The
need dental
biggest,
insurance.
yes, the biggest myth
Yes.
out there.
This
So
coming
what
from a
I've
dental or
done is
insurance broker. Yeah.
this. Yeah, right. What I've simply done has I've come up with an in-house membership plan. So yes, you can
Mhm.
only use it here. You know, dental insurance, you can go wherever is in network with your dental insurance, right? But this
Right.
one is only in-house. You can only use it at Lifestyle Dentistry. But it's set up like insurance. It makes the patient feel like they have insurance, right? And
Mhm.
I go a step further and call it assurance, right? Um, because yes, and and it's because um I'm the one looking at you, diagnosing everything, taking the x-ray. So it'd be silly of me to deny anything, right? So you won't
Right.
have to face any denials. You don't have any maximums because what insurance does is say, hey, yeah, give you this insurance, and we're only going to give you about $1,000 total to help with that, right? And so there's no maximums, there's no waiting period. Insurance will make you pay for a certain amount of time before you're basically vested, right?
Mhm.
um and then they'll say, oh, now we'll give you some coverage, right? And so with my in-house membership plan, there's no waiting period as well. And then I also offer 3 cleanings a year under my membership plan. And why, I always tell everyone, you should be getting professionally cleaned 3 to 4 times a year. Insurance is they're the only people that make you feel like, oh, I can only get clean twice a year. No, that's what they'll cover you for. That's what they'll, pay
Oh.
for.
Uh-huh.
But and I do this because they're not paying for it. You pay them monthly. Your
Uh-huh.
monthly fees are what's really covering it,
Prepaid
right?
dental care. Yep.
Um, yeah, yeah, yeah. And so they're the only ones that are saying, oh, we can only get 2 cleanings a year. No, you can be professionally cleaned as much as you'd like, really. But I often say, yes, at least 3 to 4 times a year.
Okay. Yeah,
Yep.
uh, it's shocking how much people will base their healthcare on what they think what their insurance will cover versus being
Yes.
proactive and self-paying. And when you self-pay, you actually usually get a better rate because providers
Yes.
are contracted with these insurance carriers. So they're kind of jacking their prices up so that they can be paid. I mean,
Paid.
of
I
course they
mean,
would.
it's
And
yes,
yeah,
yes.
and
And
I
it's so sorry. I don't mean to
no, 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 go
interrupt
ahead.
you, but even with my in-house membership, like I'll even give you up to the $1,000 credit, right?
Hmm.
And why I bring that back up is because even though insurance gives you a maximum of 1,000 or $1,500, they don't let you use it on what you want to use it on. They still tell you, well, nope, no one can call their insurance and say, hey, that $1,000 maximum, I want to use it all on this. They'll tell you no.
Yeah,
Versus in my in-house membership, you tell me what you want to use it on, and I'll let you use it.
yeah. Imagine that. And I think that dentists in the dental community are way ahead of the rest of the providers out there because it's very common for dental practices now to not take insurance because dental
Yeah.
insurance, just to your point, they don't pay on
Hmm.
everything. And so now you've got angry
Right.
patients because so it's just stay away
Yes,
from it.
and the last thing I actually love about my in-house membership is that my patients actually choose me. They're not just coming because I'm in
Yeah,
network with their insurance.
right.
And that right there, they're choosing me because they trust me, not just because it is, their insurance company is telling them to come here to save money.
Exactly. And, as far as needing to go somewhere else, most people once you've chosen a dentist, you don't go anywhere else. I mean, it's just you find the dentist that you work with and that
Right.
you like, and that's a pretty good relationship right there. And we've been going to a dental practice over in East Cobb well, my kids have never seen any other dentist,
Any
any other
other, uh-huh,
dentistry.
uh-huh.
And the
Yep.
reason we started going there was because they were the first place that we went to that didn't say you need to have everything replaced. When we first moved to
Mm,
Atlanta, I had just had a cavity filled, and it was 6 months
uh-huh.
later I had a dentist appointment. And he was like, "Yeah, it looks like we need to replace a couple of these fillings." I said, "Well, I just had that done." That was 24 years ago. I have
Okay.
yet to have anything replaced.
Replaced. Yes. And
No,
that's yeah, that's great that you bring that up because I tell patients all the time, if I cannot show you and explain to you why you need something done, don't do it. I have way too
yeah,
many patients who have come in and say, "Well, I just did it because they said I needed to." And I tell them, I appreciate you trusting us, our professional opinion.
yeah.
And if I can't show you and explain to you why, don't do it because I don't want you leaving lifestyle dentistry saying, "Well, she just said I needed it, so I just got it done." Um, and
Oh,
so
yeah.
I make sure I tell patients that.
So it sounds like education is a big part of what you're doing as well, making sure that folks
Mm,
understand why, because you deal with more than just the cleanings, which is what we'll get
yes,
into now, because you
yes,
specialize in your lifestyle dentistry. You've got
yes,
the ABCs of of dentistry.
yes, yes, yes.
Talk a
I
little bit about that and how you incorporate all that.
Yeah, so I actually tell patients that I'm a holistic dentist, right? And so everyone that word holistic, they think that it's always this kumbaya stuff, right? And it's not
Tambourines in the
necessarily
background.
that. I say holistic, and when I say holistic, I'm spelling it WHOL, like holistic, right? And so I look at the whole body. Like I listen to what you say. I ask you even more probing questions, than what my intake form asks about. And why do I do that? Because I do something also called root cause dentistry. So you'll hear me in BNI say we focus on the ABCs of dentistry: airway, breath, and cosmetics. Well, further that, the D and the E is dental education, right? Of the ABCs. And I start out by, of course, if you come in with a chief complaint, hey, this hurts, I'm going to look at that and make sure you get out of pain. But once you have been here, visited, and realize that you can trust me, and you like coming here, I really do start with looking at your airway. How do you sleep? Are you always tired? Can you fall asleep at the drop of a dime? Like, do you stop breathing at night? And so I like to start my patients out with a sleep test. It's a little ring that I send them home with, and they will sleep with it for 2 to 3 nights. And I get to see what's going on. Now, I cannot officially diagnose them with sleep apnea,
Mhm.
so I work with a group of sleep physicians to do that. But I know what all the numbers mean.
Right.
And so I'm able to have conversations with them. And, I tell patients all the time too, like, let's say we do this sleep test and you're like, okay, doc, yeah, I understand that, but I don't want to do anything about it right now. I'm okay with that because now we've made an educated decision. So now you know something is going on and you're just choosing not to do anything about it just yet. It's not guessing, we're
Right.
not guessing why you're tired, why you can't sleep at night, why you're always getting up to use the restroom, things like that. Now we know why. And so then we get to just again, I'll wait on you. I'm always ready to roll, but when you're ready, I'm here to help.
Now, when you do, if someone were to say, thank you for giving me all that information, I don't know if I'm going to have anything done right now. Are there things that that person, well, I'm assuming this is probably case by case, but are there things that folks can do once they know that this is, that there is a situation? Are there corrective measures that someone can take to kind of see if they can DIY it themselves or DIY or
Yeah.
whatever?
Normally, honestly, no. And the reason
Okay.
I say that is because so let's just say heavy drinker or someone who could you lose to who could you who could lose a few pounds,
Right.
right? Those things don't cause the sleep apnea. They exacerbate it, they make it worse,
Okay.
right? But they don't cause it. It is an underdevelopment of an airway or an underdevelopment of a jaw,
Okay.
right?
Interesting. All right.
And so I can tell them, hey, if you want to try to DIY it and lose weight and stop drinking or whatever the case, go to bed earlier, take some vitamins, take some
Mhm.
melatonin, things like that. I can totally tell them that, but I always let them know that's not what's causing the sleep apnea.
So are people predisposed to have sleep apnea?
Yes, ma'am. Oh my goodness. It starts when you're a kid.
That's just, it's a developmental thing. It's not a, you don't get it. It's
And
develop, it's not
yeah,
something you catch, or
it, it,
it's a,
exactly,
it's like ear
exactly.
tubes, like ear
Mhm.
issues.
Exactly. Well, this is so perfect, Stephanie. It's like ear tubes or ear issues. That's because you're not swallowing well. That
Because it's all right.
that
Yeah.
tongue to the roof of the mouth is what creates the true great
Right.
swallow, where you close off and swallow. And so patients who have consistent ear issues and infections and things like that, they are not swallowing properly. And
Is
guess
it,
what that has to do with? Airway.
is it hereditary?
Can be.
Okay.
Most times, so hmm, I say in my presentations, I always say that an an underdeveloped child becomes an underdeveloped adult. Okay, and so we see children who mouth breathe, or they can't really, their nostrils are small, they have crooked or crowded teeth. Those are patients who have underdeveloped jaw, underdeveloped airway. Okay. And
Okay.
so we think that, little Susie, she's only 5 and she snores so loud. And we joke about it and we overlook it. Susie is struggling to breathe,
Mm-hmm.
right? And so you kind of bypass that because, again, not anything immediately
Right.
devastating,
Nothing
right?
hurts. Yeah.
Nothing hurts. She's not bleeding. She's not, but Susie is struggling in school. When Susie falls asleep in the car ride on the way to the mall or wherever, Susie
Yeah.
is tired. She's not getting. It's like it's crazy. 43% of children who are on ADHD medication simply cannot, they're not sleeping well. They don't
Mm-hmm.
have ADHD. They don't have it. They're just being misdiagnosed because of their hyperactivity. Their hyperactivity comes from them not sleeping well. They're trying to function off
Right.
of no well rest, right? And so they have this hyper, it's this thing where they
Yeah.
can't focus well because they're
Yep.
trying to compensate for being so doggone tired.
Um, my grandfather actually passed away from sleep apnea. He was,
Mm,
which, I mean, if you got to go, that's a good way to go, because
in your sleep
he kissed my grandmother goodnight, and
and
he,
didn't wake up.
yeah.
Man.
Um, but he was a huge snorer, and this was
Hmm.
back in the, I think he passed away in the late 80s, early 90s.
Okay.
Well, it was 90, it was in 1990, because it was right before the Persian Gulf War, or it was during
Okay.
the Persian Gulf. Anyway, but he would also always fall asleep in the middle of a room. Like, he would be sitting in a
Yep.
chair and we'd look over and he's just cutting logs over there. And it was just
Yep.
sort of, and he ended up diabetic in later in life, and then he lost a
Hmm.
bunch of weight, um,
Hmm.
because he had to stop drinking and, eat better.
Hmm.
And
Hmm.
then, but he never stopped snoring. And because he didn't catch apnea, he had it, and it was,
Had it.
but it's one of those that, again, it doesn't hurt. I mean, you're not physically hurting, you're not bleeding out. There's not an emergency
Yeah.
until there is. And I
Yeah.
think that
And
is, go ahead.
no, I was going to say, and that is the bane of my industry's existence. Like,
Yeah.
even let's just back up and go to a toothache or a chipped tooth, broken tooth, right? Well, it doesn't hurt and it's not in the front of my mouth, so I'll just leave it until whatever, right? And so there's no sense of urgency for
Yep.
a lot of people to get dental work done and get dental, and to see a dentist because there's no, there a lot of times there's no immediate effect.
And because it's not, may not be keeping you from doing your life things. Like, if your arm
Exactly.
hurts, your shoulder hurts, then sometimes you're like, okay, I got to go get this done.
For sure.
And it's- I think that there's a belief that our teeth are our teeth, and it's not a
It'll
big
be
deal. If we
okay.
lose a tooth, we lose it. Yeah, I don't know.
Yeah,
It's
especially if you can't see it. If it's in the back, don't worry about it.
right.
That's a real thing that people think about. Dentistry can easily go on the back burner
Yeah.
because it doesn't hurt and you can't see it.
Well, and to your point, if things get left alone too long and there is a problem, that causes infection, and that infection just goes
Absolutely.
straight into the system. And
And it does, and because our heart doesn't give out when that bacteria doesn't give out immediately. When that bacteria goes into you keep putting it off because
So
it's not an immediate effect.
are we living longer these days because our dental care is better?
Oh, I 100% believe that.
I never
I
really thought about that.
I 100% believe that.
And I do know that countries that historically, I mean, from what my, again, this is what I grew up understanding, but dental care can be a sign of social status.
Yes.
And
Okay.
for areas that are not as I don't know what's the right word, developed. Thank you, Abby.
Uh-huh.
That the dental, the lifespan may not be as long because you do the your dental care is not there. You lose your teeth, and of course, if you
Mhm.
lose teeth, you can't eat as much. I mean, it's
Mhm.
so being it is a would you consider it a privilege to have dental care? I don't know if privilege is the right word, but it's we
It
are very
for
fortunate.
you are very for I mean, if you look at third world countries too,
Hmm.
right? Very fortunate to have places who this is tough to say because I don't want to say it like we're superior to anyone, but the education here, right?
Right.
And it's in our face, and we have the privilege of learning more about things, right? But it is almost a privilege to be in a place that has
A toothbrush
a
and some
toothbrush.
toothpaste.
It really mouthwash, like it
Yeah.
really is. And so yeah, I totally agree. It is a privilege, and we are living longer because of access to care and knowledge of the care that we need, and knowledge of the things that help our body versus hurt our body.
What I it and I do know that dental care over the last 50 years has changed and people are I
Mhm.
mean I remember my uncle he had a whole new set of teeth because everything he just had them all taken out and they were great but you don't see as many people having at least I don't you may see
Okay.
people but I feel
Uh-huh.
like there aren't as many as well and again I am in a little tiny bubble right here but do you feel that the amount of like resetting someone's mouth has gone down? Like are we taking better care of ourselves now than we were back then? I mean,
I I feel like we are.
okay.
I feel like they're how do I want to I
Well,
just feel like they're go ahead.
schools, I know schools do a lot of screenings, and I think
Uh-huh.
having that early intervention and for folks that may not have the access at home, there is more identifying if someone needs to have a toothbrush or you know what I mean? Like I think that there are more eyes on us here and more checks and balances.
For sure. I and the reason I was even hesitant because I do think that we have access and we're taking better care of ourselves. And I still think there's a gap that needs to be bridged because we don't have enough of the clinics or for the underserved and the
Yes.
for the because yes, I'll get into this, but
Wow.
dental work can be expensive, right? But I say this to patients all the time. It's not dentistry that's expensive, it's neglect that is expensive. Because if
Yeah.
you have the privilege and the knowledge to come in 3 to 4 times a year, I get to lay eyes on that and I say, hey, this is a small cavity. Let's watch it, right? And so
Hmm.
if that cavity gets bigger, I get to say, okay, hey, now it's time for either a filling or a crown, right? Well, that's one tooth. If you stay away and let things go and go and go with no one seeing you, no one taking care of you, no one doing
Uh-huh.
X-rays on you, now when you finally come in, I'm like, you have six huge cavities, six teeth that need crowns if we want to save them. Well, doc, I can't afford it. I don't want to save it. Now you got six teeth that are going to be missing that I have to
Yeah.
pull out. And so I tell patients all the time, dentistry seems expensive, but neglect is way more expensive.
And for those folks that I do write dental plans for, one of the biggest things that, you know, most people just want to have dental insurance so they can, I think it's an accountability piece. If you're paying for it,
Uh-huh.
which I mean, having a membership gives you
Uh-huh.
that same kind of accountability.
Yes, yes.
Um, but if, oh, I just lost where I was going with this. Oh, it had to do with,
That's okay. Care and access to care,
uh,
expensive.
yes, all the
Okay.
things. So let's talk about something a little different. Can
Okay.
you tell us, are you able to tell us like your most exciting case or is it like I don't know, the biggest cautionary tale that you've encountered?
That's a great question. I'm so bad at things like this because, I'll have something that great has happened and that I loved, and it was my first, case that I love, and I'll forget about it because I'm on to the next case, right? Um, let's see. I don't know if I have, I think this is going to sound like such a sappy story, but it's a couple of things. Patients who literally cry after I give them the mirror to see things, like, that always gets me. Patients who
Oh
literally
my
come in for a
goodness.
hug after, treatment, that always gets me. Um, my sleep patients, the airway patients who say that now they are dreaming and they have not dreamt in so long, those are the things that make me kind of pause like, "Oh god, I love what I do. I still really love what I do."
I mean, I'm getting goosebumps all over for you. That's amazing. And I think, I mean, obviously that was probably one of the reasons you went into this
I
was to make a difference in someone's life.
For
And
sure. I do recall the most embarrassing moment, um,
okay, for
of
you
my
or for the
dentistry.
patient?
For me.
Okay.
So I'm working on this patient, everyone's laid back, mouth open, all of that good stuff. And so I'm a very fair skinned patient. And so I see a piece of black hair like on her neck. So I'm talking and everything. And so telling her what I'm about to do. And so I go to grab the piece of hair to get it off of her neck and chest. And it like pulls her neck, like it is so attached to her.
Oh.
Oh my God, Stephanie, I could have died.
What did
I
she
could have
do?
died. And she just kind of like, because I literally like pulled it, like I'm trying to get up, and she just, her neck kind of just went. She's like, and I was like, I am so sorry. I
Did
could,
she
I
did
could
she
have
know it was
died,
there?
Stephanie. Clearly, it's so long. Surely,
Not
surely.
necessarily. Those neck hairs come out of nowhere and they
But
get so long, so
it was so long, and maybe you're right. Maybe I've been kind of blessed to not have, but Stephanie, it was so long. It was from her neck, like on her shirt, like her chest, and I'm just like picking it up to get the hair off, and her skin, like
Did it
Stephanie,
come
I could
out? Did it come out?
no,
Oh,
no.
so it's you had to stay there and look at it.
So she left with it.
See, I would be thankful that someone did that. If I,
Yeah, I was so embarrassed. Like,
oh my gosh, that's hysterical. That's a good story. I like that. All right. So let me see here. Um, okay, if you could change one fear of dentistry and
Mm,
dental work,
okay.
because people get so nervous about going to the doctor. And do you think it's the sounds? Is it the sounds and the sensitivities, or what is it that makes?
Um, I do think that that's a part of it. I do think, ooh, this is really layered. I think that the sounds are a part of it, right? Because
Mhm.
I mean, it's a drill. It's like and it's in
Yeah.
your vibrating in your head. I do think that. I do think that they have a true fear because of something that happened when they were younger. Um,
Mhm.
Dentists nowadays just have a little bit more care. Than what maybe dentists had. I don't have great dental stories from my childhood. He wasn't mean, but his hands were so big, and I was so small, and I remember his name too. Like, I don't know why. He definitely didn't make me want to be a dentist, but And so they're young and they're scary, and
Yeah.
there's just no, I feel like back then they probably didn't, and I say back then, I was born 79, but I feel like there weren't a lot of pediatric dentists. So the dentist treated the kids like they were just small adults, and children are not small
That big
adults.
light in
Like,
your face.
yes,
Yeah.
they just don't compute things like adults do. And so I think that they fear the dentist because of something that's happened to them when they were younger. Um, Also, make sure I remember my fourth point. So my third point is, it's such a vulnerable position to be in, laid back, upside down, mouth open, right?
Hmm.
Um, and I mean, it's just a vulnerable position to be in. So I think that too, gives them some fear, and things going down their throat, or what I mean, not being able to breathe, things like that. And then the last thing I'll say is that I think that people fear going to the dentist because they just think that, not everybody, but they think that dentists are only out to get their money. That, you know what I mean? That they
They're
just,
looking for something. They're like looking
yeah,
for,
they're
yeah,
looking for something. Everybody thinks dentists are rich. And I'm on your podcast to say, hello, that's not true. That's not true. Um, And I think that they just fear that they're going to be taken advantage of. Like, they,
yeah,
hear stories, they may have experienced something. And then, of course, any negative news is going to spread faster than the good news of people. And so we have social media now, and you can actually leave reviews for people. And so if you have bad reviews, people are going to go straight to, I mean, when I look at reviews for other places, I go straight to the bad ones first to see why did you give them 1 or 2 stars? Like, I'm
right.
still, I still may give whatever I'm looking at a chance, but I want to see why somebody felt propelled enough to go leave a 1 and 2 star review.
Sure.
Right.
Yeah.
And so I do think that on the flip side, reviews are good because you get to see who you're going to, where you're going to, and it's not a guessing game where, I'm just going because they're in network with my insurance. Right now, you actually get to go
Right.
on and see what the public is saying about this place. So, not saying your experience will be the exact same, but gives you a little bit more comfort
Yep.
growing.
And I would imagine that would keep your practice. That's an accountability piece right there, because I mean,
For sure.
we all know now word of mouth is key in
For
a
sure.
in an industry, or in any industry really, but
Yes.
especially in an area such as Atlanta that's so saturated with everything.
Yes.
And I do think that I know for sure over the last 20 years there's
Hmm.
been changes, and there's been a little bit more um care given to the pediatric part of it. And I think
Yes.
you nailed it. I think it's like that's why we're a little worried about going to doctors, because when we were younger, every time we went to the doctor, we got shot. I mean,
God.
it's like, why wouldn't we be scared? You got to take clothes
Exactly.
off, you got to sit in a paper thing. I mean,
Exactly. Exactly.
it is, and I do know that's one of the things that we when we moved to Atlanta, oh my gosh, we had the weirdest experiences with dentists. We were over in the Dunwoody area. I
Uh-huh.
went to a dentist who did not, well, first of all, the hygienist didn't clean my
Hmm.
teeth. The dentist did, which is not
Okay.
a huge deal.
Because I do that sometimes too, but why
Sure.
didn't the hygienist clean if they had one?
Also, but that really wasn't the big thing here. This is going
Okay.
to gross you out. He did not wear gloves. He did
Wow.
not wear gloves.
So when did you get here? Like late
This was,
80s?
well, no, it was 99. It was in
Oh my gosh. And he
99.
still didn't wear, it's so funny because, really quick, I don't mean to cut you off. So
Yeah, no,
sorry.
go ahead.
It was a guy. It was
Yep.
he male. Um, he was old school. And the reason I say that is because, was he older? Would you say?
No, not that
No?
much. He was probably in his late 30s, early 40s. I don't know if that's
Oh no, that's weird. I had an instructor in dental school. So I was in dental school 2004 to 2008, and I had an instructor. He was old though, like and I say old, so sorry if anyone, he was older. He was like late 70s, and
hmm
every time he was in my clinic, he would go in a patient's mouth bare hand, wash his hands, but barehanded, and would go like, So yes, and I'm like, oh my gosh, like, but again, there was a time where he truly did not wear gloves.
And, I know that, well, I mean, in the late 80s, early 90s, AIDS was a big thing. So everybody had gloves
Uh-huh.
on. You did not
That
touch
and that
it.
and that's when the gloves came in play.
Right,
Is
right.
when it was the AIDS epidemic.
But so I needed to have a crown done. And after having my prevention, I was like, I am not coming back to this place because no. So I had to go back and get my record so I could take it I went back to my dentist in Greenville. We'd already moved down here. So I had to go
Uh-huh.
home to my dentist to have it done. And they said, well, why aren't you having it here? And I said, well, I was a little uncomfortable that he wasn't wearing gloves, and he said that they said that, well, the gloves are for your protection or for his protection, so he was fine, you're fine. They are like kind of argued about it. I'm like, okay, you know what, I'm out of here, go. So,
Anyone watching this, the gloves are protection for the patient and the doctor.
and the doc.
Same way the mask is. It's to protect you from me and me from you.
Yes. Well, and again, to your point, our mouths are gross. I mean, we've got all kinds of things going on in there because
Yes, for sure.
they're the filter to what's going in.
Exactly.
My dad was a urologist, and so my mom she was a nurse as well, but she worked for him for a few years.
Uh-huh.
And I was like, Mom, you really, that's the area you want to go down and work on? And she was like, I'd
Uh-huh.
rather do that than be in someone's mouth. There's so much stuff going on in there. She
It's
was
so
so
it's so
grossed out by
true.
dental care. And I'm like,
It, I love when I have patients who come in like, I'm so sorry I didn't brush after lunch. And I'm like, you have no idea what I've seen. This
oh,
little bit of food is a-okay.
um, and I'm very proud to say that I've gotten a lot of good feedback on my flossing. I've become a very good
Yay,
flosser.
good, 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 good.
When I heard that my gums were receding, I'm like, oh, all right, time to fall. So, but dental care is to me one of the biggest and easiest ways to prevent. I mean, there's so much prevention that we can on a day-to-day basis, just making sure that we
Yeah,
are doing
yeah,
what we can to keep our mouths as clean as possible. And a lot of that
yeah.
is just
And I think if
wisdom.
we had a system that would, so let's say whatever it is, you go into the doctor for liver, for diabetes, for whatever, heart, all that. If we had a system that would backtrack things to say, hey, let's take a look in your mouth. Hey, how are you sleeping? We would find that majority of everything, Stephanie, starts with breathing, airway, and our mouth. And it just
Yeah,
we just don't though, because when you go for, you know if you've been diagnosed with high blood pressure, they simply just treat that, and
right.
nobody takes a step back to look at everything. And the high blood pressure is coming from you not sleeping well. So when you stop breathing when you sleep, blood pressure drops. Well, you're wearing your arteries and veins out when you start coughing to breathe again, and now it has to shoot back up to say, oh, we are alive, let's go, let's get to these organs. So it's a
You know,
big deal.
what's interesting, I just had my physical on Wednesday, and
Uh-huh.
my numbers were good. My cholesterol's a
Great,
little
great.
high. I'll work on that. But it just occurred to me that they didn't ask me at all when my last dental appointment was.
Yep. We're so we're s- we're
Whoa.
such the health and wellness team, but we act so separately. Like,
Huh.
and and it's one of those things that for dang sure should go hand in hand. Because
Yeah.
I say we because I'm a part of the industry. We miss so much because we don't do that.
Well, and I think that and you mentioned clinics and serving
Yes.
the underserved
Underserved.
population. And what are there programs out there? Like, where are some places that people
So there
could
are
go?
all anytime I run into a patient who only has like Medicaid or Medicare,
Mhm.
I have to give them those options. There are dental schools that you can go to pay lesser for treatment because
Right.
they are practicing under a licensed dentist. The instructors are licensed. And you will have great care at all dental schools because there are steps that we have to go through. If I do this, I need to
Hmm.
get it checked. If I do the next step, I have to get it checked, right? And there are also places like in Atlanta, we have the Ben Massell Clinic, Ben, Ben Massell Clinic, right? The issue, I don't want to say problem, but the issue with those places that are income based is that there is such a long waiting period,
Yeah.
such a long time because they book up so fast. And um, I don't know if they what they truly do to show that, hey, you qualify to go to a clinic like that.
Hmm.
But the waiting period is so long to get in. And so, and again, there are most times those areas are volunteer ran, right? So there are dental students who have to go put in their time, and the licensed
Yeah.
dentist will be over them. And then there are dentists who go and volunteer their time to treat the patients. But again, it's a facility, so it's so limited to the amount of chairs that you have and the amount of volunteer doctors that you have.
And I imagine is because everybody, literally everybody needs dental care.
Everyone,
It's not
everyone.
just, yeah, it's so it, well, okay. We've
Yeah.
you opened my eyes to a huge thing here. And yeah. So okay, my mind is racing about some
Everywhere. I know, I know.
all right, I was just notified that we have about 20 minutes left. So,
Okay. Okay.
I mean, we don't have to jump off right now, but I want to make sure that is there anything that comes to mind that you want to make sure people take away from any of this? Like what is there a PSA, so to speak, that
Um,
other than what we've kind of talked about taking care of yourself or go what to do when, I don't know, things to look out for, just
yeah. So you've heard me mention this in BNI. There are two basically phrases that I will say that kind of gets a chuckle out of patients. And
Mhm.
one of them is only floss the teeth you want to keep.
I don't know
And
why you're not writing a little book with all the I've written down all these little words that you've created. So
and then the next one is be true to your teeth or they will eventually be false to you.
N-
And it's really true. Like if you're not true to your teeth, you will have false teeth. Like they will all come out and they will be false to you. Um, and so like I literally just want a takeaway is don't neglect your teeth. Like, find some place that you trust. Find some place that will work with you financially. Find some place that offers third party financing if it's too expensive, but get the work done. You'd be surprised at how much better your health would be if your mouth were taken care of, if you didn't have aches and pains. Like you can't function. Like it's I don't know if you've ever seen anyone, witnessed anyone in dental pain. Like I've had patients crawling in here,
yeah.
and again, the more that you can stay ahead of the game, the better, because you'll save money preventing things versus paying for things that where it's already happened. We can't prevent it from happening anymore. It's already happened. So now you have to make a bigger dollar sign decision.
And on a kind of a different note on that is that if your teeth aren't what you want them to be, then sometimes you don't smile and or you don't show your teeth and you're not smiling. And that
Yes,
brings you down. And I
it,
mean, you may be the
it really
happiest
does.
person, but if you can't express your
It,
happiness,
if you smile and cannot show your teeth, that you have no idea what it does to you psychologically.
or if
And
you're
it
avoiding things because
or
of
if
your
you're
teeth.
avoiding things because of your teeth. I've had presentations that I've given to entrepreneurs, Stephanie, like how much business are we missing out on because when you have close quarters with people, your breath stinks. I literally have had patients come in, and I love when they're this candid with me. I've had maybe a couple months ago a patient that came in and said, "I need to get this tooth taken care of." I always ask, "What's motivating you? Why all of a sudden now? Is it hurt?" Yes, it has been hurting, But, and this is where he shared his story. He said, I had a client who told me, hey, man, I really want to do business with you. And it's very hard to talk with you in close quarters because of your breath. And that, I say this jokingly too, but that customer has just secured himself a spot in heaven, Stephanie, because we're not we're not candid with each other.
We
Like,
need
you
that
know,
feedback.
we
Yes.
need that feedback because
Yeah.
we have sensors in our nose. They're called adaptative sensors in our nose, where
Mhm.
I may not smell anything anymore because I'm around myself all the time, right?
Yep.
But when I'm in front of someone new, they smell it right off the bat
Yeah.
because it's a new smell to them. It's kind of like going to a grandparent's house or something that smells like mothballs. Well, they don't smell it because they live
Yep.
there, right? But when I walk in, I'm like, whoa, Granny, where are the mothballs? you know?
I've had to
So,
tell someone, I worked at a restaurant. I was a manager for a couple of years, and we had a server that was, I mean, it was hard for her to serve food without people, and it was an Italian restaurant. So I mean, for it
mhm.
to, and I had to have a conversation with her because the owner wouldn't talk to
Yeah,
her. And it
it,
was, and I hope that I hope it made it that she was able to get something taken care of, because
mhm,
I think
mhm.
it was one of those that would keep her from even dating or having a relationship with
Yes,
someone. And I know that, I mean, so it's not just about cosmetics, it's not just about it hurts, but it's also about how your general outlook on life and the
yes,
things that you may or may not be doing
yes.
because of that.
Yes, and
Um,
the way I get people's attention, and you may remember me saying this in BNI too, especially around holiday time, is hey, go get your teeth cleaned. You don't want to be the family member that they talk about when you leave.
right. I
It
mean, probably will
happens.
be, but not for that.
Exactly. Don't let your breath be the reason
Right, right,
that they talk
right.
about you. But it happens all day, every day. Like people just it's and don't get me wrong, I'm not saying it's easy to have these conversations, right?
Right,
I literally talk to patients that it's hard for spouses to tell their spouse that their breath stinks, right?
right.
I have patients who come in here like, yeah, my wife says that my breath it yes, and I say, oh my goodness, I'm so glad you have a wife that loves you.
Yeah,
I'm so glad you have a husband that loves you because they're telling you that because they love you.
right.
And so I'm not saying that it's easy and it's necessary.
Well, and it's because it's not anything that's going to get, if you're not going to say, I mean, it's coming from someone hopefully that you trust. But I
Yes,
do think that when we are given that kind of feedback, it's important for us to really take that into consideration,
yes,
because it's not easy
yes,
for someone, if someone had to came
exactly.
and, mustered up that
Yes, that courage to have
courage.
that conversation. It
Yeah,
really is love. It really is care.
right.
Um, and
Which
so,
is one of the reasons that going into B&I real quick for membership committee, which is I've always said, don't avoid the conflict, lean into it. And if there's a
mhm,
problem, let someone correct it, give them the opportunity
give them,
to,
yes,
because
I totally
we
agree.
don't know things. We are
I
very
totally agree.
visual, nose blind. There's all kinds of
Yes, I totally agree. And I'll take it even a step further is if a member of BNI has done you wrong or made you feel some type of way, it needs to be addressed because it may be a blind spot for them.
Absolutely. And you don't want that.
Address it, don't let it
Yeah.
build up, address it. Have us membership committee address it because
Yep.
it may not be them being a jerk. It could truly be a blind spot for them
And it gives that person the opportunity to correct. And if
to
that
correct.
now what happens after that, then you can
Exactly,
form your opinion.
exactly. Then we're starting to talk about some real
Right,
things.
right.
It's so
So,
true.
because I will say, generally, I mean, not generally, every time there's more than two sides to a story. And so,
For sure.
having the courage to have that open communication, I think but if your breath smells bad, you may not feel so obligated to speak up.
Speak up. Exactly. So true.
Oh my gosh. Okay. So I'm going to go ahead. We're going to go ahead and close this down. One of the
Okay.
questions that I sent you was if your practice could have a song, what would, I think that's how it was
Ooh,
phrased. Um, let's see. If your
yeah.
practice had a theme song, what would it be and why?
Hmm. I've actually thought about this. I've had a question very similar to this. So I probably would have a office theme song and then a personal
Okay.
theme
What would
song.
those
And
songs
you know
be?
what? I will break up my personal one to okay. So because I go back and forth between the personal one. So my personal one would be probably Run the World by Beyonce.
That's yes.
Girls, we run the world.
Yes.
I love it, love it, love it.
Love it. That's on my playlist.
The other one would be probably Rise Up. Do you know who Andra Day is?
Yeah.
Um,
I
Andra
was getting
Day.
ready to hum a tune or I won't say,
Yeah,
but I think I know what
please do.
song you're thinking
But
of.
yes, but between that one and there's a song by One Republic, Good Life, I think.
That's a
It would
good one.
probably be one of those two. And it's really because, first of all, if I did the One by One Republic, just because we do so much more than dentistry. Like we really do bring a lot of good and good feeling and good vibrations to patient. Like, we're creating more confidence, making them feel better, sleep better, feel healthier and all that good stuff. If I chose the Rise Up song by, I think I'm pronouncing her name wrong, Audra Day, maybe.
I
I
don't
keep
know.
wanting to put an N in it, but I would choose that one because every business and business owner like totally gets knocked down at some point, and there are months when it's super hard, employees leave, equipment breaks, and you just really wonder, like, what am I doing? Why did I get into this? Like, you know what I mean? And so that's part of the journey, is just rising back up from all of those ashes and those downfalls and everything, and
Yep.
just having the opportunity to show up the next day and spin it all around. Like though I think those are the ones I would go with. I probably gave you too many songs,
No,
but
that's great. Those are awesome. Um, because and you're so right. We do have those moments where it's like, why are we doing this? What in the, I
Mhm.
mean, are we
Yeah.
supposed to be? And then
Heck
generally we're
yeah.
given the sign that yes, you're on the
Yes.
right track.
Very true.
But we had to learn a lesson in order to get to that
I,
track.
I've had conversations with God because those bright times can come so few and far between sometimes. I'm like, you can send me a message a little bit more, a little bit sooner if you'd like
Yeah,
to
a
let
little
me know I'm
gentler.
on the right track.
I'm listening. You don't have to be so loud.
You don't have to take so long to have a patient that shows a lot of gratitude. Like, you can tell me more.
Well, and I don't know if you found this, but I know that I work with a lot of people, like-minded people, that which means I work with a lot of procrastinators. I work with a lot of folks that overthink. I work with a lot of folks who are too smart for their good and
Yes.
need just a little bit of guidance. And I think that's what I like about what I do because I'm around people who are in the mix, if you will. And I think when we
Yes.
put out that kind of energy and when we're the kind of person we want to work with, then we get to work with the kind of people
Yes.
that we
For
want. And
sure.
that's
For sure.
as
For
a
sure.
business owner, that's a dream because you get
Yes.
to build the community that you want to have. And that's huge. And
So true.
that hopefully allows you to sleep at night without
Yes.
snoring.
Yes. Without snoring. Yes. Yes. It
And
does.
I
You're
do
so
feel
right.
that there are going to be some follow-up podcasts for the bunch of us. But I do
Mhm.
when we do another one, this will be our little teaser. I want to hear more about the your CPAP or the alternatives that you have for that because
Absolutely.
I know that giant machine is a huge reason people don't want to get
Yes.
diagnosed because
Yes, they
they
are. I'm
don't want
telling
that.
you, my big ones are snoring and bad breath, and especially with my patients who are single and dating. Like they don't want to wear that CPAP. It's too big, it's embarrassing, and the ones who are dating and they want their breath fresh and all of that good stuff. So I'd be more than happy if you had me back and we just dive into those things.
Absolutely, absolutely. All right. Well, Dr. Aja, thank you so much for being on here today, and I
Thank
look
you for
forward
the
to
invite.
sharing this and hopefully get some folks into a chair and get their teeth looked at and
Absolutely.
get
I
on top of it.
appreciate you so much. Thanks for doing this podcast. It was so fun.
Absolutely. You have a great afternoon.
Okay, you too.
Take
See you
care.
later.
Bye bye.
Bye bye.
Well, thank you for joining us on another episode of Stuff You Should Know. If today's conversation reminded you that your oral health is about so much more than your smile, then we have done our job. Be sure to connect with Dr. Aja Nichols, schedule that dental appointment you've been putting off, and remember, only floss the teeth you want to keep. Until next time, take care of yourself and keep learning.